Hey everyone, and welcome to today's video. Before we dive in, make sure to hit that like button and subscribe to the channel for more informative content like this. Possibly the biggest drawback of being a man is having a prostate, because it is a gland that, as I'm going to explain to you, is practically useless. Over time, it has a natural tendency to become inflamed, and later on, the dreaded prostate cancer can develop. Fortunately, as I'm going to explain in this video, researchers have recently discovered that there are two types of foods that can significantly help us reduce the occurrence of this feared cancer. But what exactly is the prostate? Well, the prostate is nothing more than a gland that sits below the bladder, like a cuff surrounding the urethra. So, what function does the prostate have? Basically, it releases or produces a type of substance that enriches the semen, giving it a series of nutrients so that the sperm have greater longevity, meaning they live longer. But I'll tell you, it's perfectly possible to be a father without having a prostate, or with one that doesn't work. The problem with the prostate is that, over time, as the years pass, it becomes inflamed. That cuff that surrounds the urethra swells. Men affected by prostatitis, that is, inflammation of the prostate, you may have heard, or if you are a man, you will know that there is a greater tendency to urinate in spurts. And with time, the tendency for that inflammation to turn into the dreaded prostate cancer is very, very high. So, what are the risk factors for prostate cancer? Well, basically, the first is age. It's a disease that occurs in men, especially after the age of 40. It's not normal for a young man of 25 or 30 years old to have a prostate problem. It's also less common in Caucasian men, in men with white skin, than in men with darker skin or complexion. It's also true that there is a greater risk of having prostate cancer if you have an inadequate diet, if you are a smoker, etc. Here, it's basically the same as with most cancers. But recently, researchers from the University of South Australia, I'll put the study below in the description because I consider it to be a very, very interesting study that will change the way we approach this disease. We're studying what diet they had to give to patients who were undergoing radiotherapy after having their prostate cancer removed. These researchers, as I mentioned, observed two fundamental facts. They saw that patients who had prostate cancer had very low levels in their blood of, first, lycopene, lutein, alpha-carotene, and especially selenium. At the same time, they had very high levels of iron, sulfur, and calcium. Of course, when you do these studies in a very large population, because these people studied this in very significant samples, not the classic study that takes 15 or 20 people and draws the conclusion they want, but rather they took a very broad group. When you see that this profile occurs in many people, it already gives you an indication of what is happening in the body at the level of nutrition. That is, there must be a very clear relationship between these deficiencies and these excesses and the appearance of prostate cancer. Clearly, this is the case. It has been seen, and this is, let's say, the conclusion of the study carried out by these people, that if you have less than 0.25 milligrams of lycopene and 120 micrograms of selenium per milliliter in your blood, the risk of having prostate cancer is much higher. This is very, very indicative because, of course, as a result of this, you deduce that if you introduce foods in your diet that guarantee you have adequate levels of selenium and lycopene, you will clearly have a lower risk of suffering from the disease. At the same time, you should avoid foods that are excessively rich in, for example, calcium and iron, which were the minerals that were most increased. So, what should you eat if you are a man and want to significantly reduce the risk of having prostate cancer from the age of 40? Well, first of all, foods that are very rich in lycopene. What foods are those? Point number 1, tomatoes, melons, papayas, grapes, watermelons, and blueberries. These, for starters, you have to incorporate into your diet. But I would tell you to do it today. And obviously, foods rich in selenium. And what are these? White meats, for example, chicken, shellfish, which are very rich in selenium, fish, eggs, and walnuts. Walnuts have very high levels of selenium, so if you routinely incorporate these foods, the tendency for you to have that type of tumor, that type of cancer, is greatly reduced. At the same time, you have to avoid foods that are very rich in iron, especially liver, red meats, etc., and foods that are very rich in calcium. That is, significantly reduce the intake of foods like dairy products, cheeses, yogurts, etc. This I'm referring to only in the case of trying to greatly reduce the levels or the possible presence of this type of prostate cancer. Well, that's all for today. Thank you very much for watching. If you found this video helpful, don't forget to give it a like and subscribe to the channel for more content like this. See you in the next videos. Take good care of yourselves.